Hello guys, welcome to my channel. My name is Abdrazak. In today's video we shall be looking at nephrotic syndrome. To begin with, there are four main components that are comprised of nephrotic syndrome. One being proteinuria, that is presence of proteins in urine, and if we have above 3.5 grams per day proteins in our urine, that can tell us that there is high chances that we are dealing with nephrotic syndrome. This can be highly selective, that is if we mainly lose proteins like albumin, or sometimes it can be poorly selective where we can lose also other plasma proteins. Now the second component is hypoalbuminemia due to the loss of albumin in urine, that is a value 3 grams per deciliter. The third component being generalized edema, and fourth is hyperlipidemia. In this slide we shall be talking about the pathogenesis. How does nephrotic syndrome occur? Basically there is damage to the glomerulus, and that results in leakage of proteins. Mainly here we shall be talking about albumin, and with the time that will lead to hypoalbuminemia, that is low albumin levels in blood. And what we should know is that when there is decreased amount of albumin in the body, that will decrease of course osmotic pressure of blood, and that will lead to edema. Another thing we should know is that the edema caused by nephrotic syndrome is generalized, so it is just general edema, and in simple terms we can call it anasaka. This edema will decrease the amount of fluid in the vascular space, and with the time we shall have a decrease in blood pressure, and that will stimulate the kidney to produce renin. So what happens? To continue, what happens when the kidney produces renin? We shall have a production of aldosterone hormone, and this retains sodium and water and provides more fluid to contribute to further development of edema. So our liver will respond to loss of albumin by producing more apolipoproteins in an attempt to compensate for the low serum osmotic pressure, and this compensatory mechanism will result into hyperlipidemia. To further continue with the pathogenesis, there is what we call nephrin. This is a component of the slit diaphragm found between the podocyte food processes, which may help to control permeability of the glomerulus. So when there is damage to nephrin, there is loss of permeability of the glomerulus, and that's why we shall have loss of proteins in urine. So what are the clinical presentations of a person having a nephrotic syndrome? For the signs and symptoms, we shall be having nausea and vomiting. A patient will come with a periorbital and perisacral edema. Patient will also have a frothy urine. So what are the laboratory evaluations? When we visit our lab, we shall find proteinuria, we shall find hypoproteinemia, hypoalbuminemia, waxy casts, and oval fat bodies in our urine. The lipid droplets have a Maltese cross appearance under polarized light. So for the diagnosis, we shall need a biopsy of the kidney, which will tell us the specific cause of a nephrotic syndrome. Furthermore, what are the general causes of nephrotic syndrome? In adults, most cases of nephrotic syndrome are secondary to systemic diseases, and to mention a few, we can have diabetes mellitus can lead to nephrotic syndrome, SLE, amyloidosis, Goodpasture syndrome, polyarthritis nodosa, Wagner granulomatosis. In children, most cases are primary glomerular diseases. The most common cause of nephrotic syndrome in children is the minimal change disease that is seen in 85% of the cases. For the specific causes of nephrotic syndrome, the four main conditions that cause nephrotic syndromes, we have minimal change disease. Of course, that's common in children. There's also focal segmental glomerulosclerosis. There's a membranous glomeruloneuropathy, rather nephropathy, and diabetic nephropathy. Thanks for listening.